Good evening, everyone, and thank you for joining us tonight. Before we get started, as always, I would like to read this brief disclaimer that you see on your screen. And the disclaimer is this: the PharmAssist virtual learning experience brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. So thank you once again for joining us. My name is Craig Orpello, and I will be your host once again tonight. And I'd like to welcome you again to the PharmAssist Virtual Learning Experience. And what is that? It's an educational program created by Mandel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your very own home. The PharmAssist program takes place every Monday at 7 p.m. Eastern Standard Time, and that's now. So strap in and get ready. Tonight, we'll be providing a live medication instructional program on 3 common fertility products, including an interactive Q&A throughout the program. And the interactive nature of it is that you are able to join us via Zoom or Facebook Live, and we invite you to be a part of the discussion by sharing your questions in either format. How do you do that? You can type them right into the chat, or you can also ask them in the Q&A section if you are on Zoom with us. So we are joined by various amazing HCPs each week from across the nation to provide you with a real-world experience, just as if you were sitting across the table from them in their clinic. So today we are joined by Laurel Meier. I want to thank you again for your time and interest this evening. And now I want to turn it over to Laurel. Take it away, Laurel.
Thank you, Craig. Welcome, everyone. Tonight, we're going to be reviewing progesterone and oil, Menopur, and then the Sanera patch. There'll be a Q&A after each video, and I encourage you to write your questions in because any question you have, I know many others will have that question too. So please focus your questions on how to use the medication, how to draw up and inject, and the purpose and side effects, and save your questions like dosing and timing of your injections for your IVF clinic. These virtual learning programs, including nights, are always available at mandelspharmacy.com, Mandel's Facebook page, and on YouTube. So to get started, I'd like to share a story of how I got interested in becoming an IVF case manager. About 25 years ago, my husband and I started having problems getting pregnant. We started using Clomid to try to enhance the, get pregnant. And unfortunately, after several rounds of that didn't work. So then we went on to IVF. We did 2 rounds of IVF, and unfortunately, it was not successful. But while we were still just reeling from the negative news of the last IVF cycle, we got a call from a friend. She was a labor and delivery nurse at a local hospital, and her patient had just delivered a baby girl, and she wanted to find parents for her baby. She was single, she was young, and she wasn't ready to be a mom. So my friend told her about my husband and I, and she wanted to meet us. So we went down to the hospital, we met her, and she chose us to be her parents. So we took our little baby girl home the next day, and it just so happens to be Valentine's Day. Then, 4 years later, we were the grateful and happy recipients of a donated embryo that was transferred to my uterus, and I was able to get pregnant and carry our second little girl to a term delivery. So she was born on the 4th of July. So we have 2 holiday babies. And now my daughters are 16 and 20. And here they are now. And I just wanted to share my story because personally, I know how hard this process is. And I hope that me sharing my story gives you a little bit more faith in your journey. I know that you're not alone. There's thousands of couples that are going through infertility right now, and I encourage you to reach out to family, friends, and other people going through infertility to share what you're going through to support you, because that really does help. It's why I decided to become an IVF case manager, because I know what you're going through and I want to help. And I want to make sure that you know that you're not alone. I want you to remember to just keep the faith, take it one day at a time. I know that if you just keep going, you too will become parents. So if you'd like to hear my fertility story in all of its gory and glorious detail, you can do that. It's a much longer version. You'll just go to YouTube and type in Behind the Shots, Laurel Meier, and you can watch that if you'd like. But tonight, we're going to focus on the 3 medications I mentioned. And my goal is to help give you the strength and courage and confidence with these medications so that by the end of this, you will feel confident, at least that you can do it. And I know that very soon you'll feel like a pro. So let's get started, Craig, with the first video on progesterone and oil. Hi, my name is Laurel, and I'm here to show you how to draw up and give the progesterone and oil. Progesterone and oil is used to maintain the uterine lining during usually a frozen embryo transfer cycle. Also, if you're going to have a fresh transfer, it's typically started on the day of egg retrieval or possibly the day before. Just follow your instructions from your clinic on when to start this. So progesterone in oil is a fairly thick medication. You want to pop off the top and use an alcohol wipe to clean the surface. And then you're going to take your needle and syringe out of the packaging. The typical dose is 1 ml. So I would draw up, you draw up 1 ml of air first, and you take off the top. Inject this into the center circle, inject the air in, and then invert. You want to pull back so that the tip of the needle is in the oil, and then pull on the plunger. As you draw back, the oil will leak down the side. Now, what we do is we have you draw up and give with the same needle. It takes away a step of having to use a draw up needle and then an injection needle, but it does take a little longer to draw it up, so you just have to be really patient as it drips down the side very slowly. Feel free to pull really hard on the end of the syringe there, because that's going to create that vacuum and pull that medication out. So if you get a little bit more than 1, that's okay. You're going to push the air in and go to the 1 line. If you don't quite have 1, you can pull more and then push back to the 1 line. So there's 1. Little teeny bubbles you can ignore. And now you're ready to give the shot. Now I'm going to recap this because we're going to go over a few things about giving intramuscular shots. This is not a belly shot. This is the one that's given in the upper outer quadrant of the hip. And it's given for many, many days, even many weeks at a time, because it's important in maintaining the uterine lining. So your hips are going to get sore. Now, the actual shot doesn't really hurt any more than the shots in the belly, but it does make your hips sore. So you're going to give a shot on one hip one day. The next day, you're going to switch to the other side, and you're going to go back and forth each day. Prior to giving the shot, if you'd like to ice the hip a little bit, that works. You can use some lidocaine cream or a Synergia patch to decrease the pain. But one really good way of just tricking the skin into not feeling the poke is pinching the skin really hard. And if you pinch it several times, it's going to trick the skin into not feeling that poke. Now, as the person that is receiving the shot, you want to make sure your hip muscle is completely relaxed. And the best way to do that is to lay on a bed, flat on your stomach, and just relax. If you point your toes inward, it's going to keep you from being able to tense your hip muscle while you're receiving the shot from your partner. Another way you can receive the shot is by standing and putting all of your weight on the opposite leg from the side you're receiving the shot. And that works fine too. Your partner can sit in a chair next to you while you're standing. So to give the shot, you want to get in the correct position, and your partner is going to pinch your hip many times and nice and hard. And with a good hard pinch, it's going to go, he or she will go straight in like a dart. All the way to the hub, let go of the pinch, and then you're going to inject this medication all the way. And it does take a little bit of time because it is a thick oil going through a skinny needle. Once all the medication is instilled, you're going to take a Kleenex, you're going to pull out and hold very firmly against the skin. After about 30 seconds, you'll check, is there any medicine leaking out? Is it bleeding? If not, you're done. If there is, just keep holding it until it's dry. Now, your clinic may have you draw up this medication with a larger bore needle. It's called an 18 gauge. If they do, I want to make sure that you know that you don't give the medication with this because this is very thick, as you can see. So you would draw up with this, and then you'd switch over to the skinnier one to give. Now, in our clinic, we just have you draw up and give with the same needle. As I said before, it takes a little longer to draw it up, but it does remove a step. So just follow the instructions of your clinic. This will go in your sharps container. Your progesterone will be good for usually for 10 days. It's a multi-dose vial, so you're going to put this away. It does not get refrigerated, so just keep it in a safe place for next time. That's all there is to it.
All right. Any questions come in for that, Craig?
Yeah, okay. So as we mentioned before, there are a number of different ways you can, if you are in the Zoom, you can write into the Q&A or into the chat. And if you are joining us via Facebook, you can go directly into the chat itself and type in any questions, just like this one that came in. And this is kind of the very basic ones that we always get these. We go from kind of the most high end of the spectrum, top line questions about the product, all the way down to very, very specific granular things. This is more on the high end, and it says, what is the purpose of progesterone and oil with regards to my cycle? So I guess a little bit more information other than what you gave already about that.
Okay. The purpose of progesterone is to maintain the uterine lining, to maintain the pregnancy. So it's extremely important to keep that home for the baby intact while it's growing. And it takes a while for your natural progesterone to start being excreted in amounts that are going to take over for this progesterone shot. So if you're doing a frozen embryo transfer cycle, your body doesn't make any progesterone on its own, and it's extremely important. It's critical for you to take these progesterone shots. If you're doing a fresh cycle, if you do an egg retrieval and then followed by a transfer 3 to 5 days later, your body is making some progesterone, but it's still important to get this progesterone shot because you're not making enough.
Perfect. Thank you very much for the explanation. I know sometimes people don't just want to know how to give the shot and do it correctly, but also want to know what's going on. So we definitely appreciate those types of questions. And that was an excellent way to explain it to somebody so they know what's going on within their body. So it's good to know the progesterone is the good one there because you know you're at a good point in the process. So that's great to know. So this question just came up that says, so you talked quite a bit about, you went through the idea of the intramuscular shot and how that works. And the question here is, why do I have to inject progesterone into the muscle rather than it just being a regular shot? And by regular, I assume they just mean a subcutaneous shot.
Yeah, that's a good question. You're so used to giving subcutaneous shots throughout your IVF cycle. And then you get to this and you're like, why do I have to give such a huge, long shot? It's a good question. I'm going to give you a little bit of background. Muscle tissue has a much better blood flow than subcutaneous fatty tissue. And so medication absorbs much faster in the muscle. Also, medication that's given deep into the muscle tissue causes less side effects. So the side effects of progesterone typically are rash, redness, itching at the injection site. And
the progesterone is typically diluted in sesame oil or another type of oil because of the chemical compound, the hormone base. It needs to be in an oily base. And this can be pretty irritating to the skin. So you need to give it deep into the muscle for two reasons. First, for absorption, and then also to decrease those side effects that I talked about. So unfortunately, has to be given intramuscularly.
Well, that's actually, it's great that you, all of your answer actually tied into this next question that came in. Some of it you already touched on a little bit. If you want to go a little bit deeper, you certainly can, but we can also get the second half. And the question is, what are the biggest side effects associated with progesterone and oil, which you just touched on right there, but is it possible to mitigate them in advance? And if not, what are the best ways to treat them after the fact?
Okay. So I did mention itchiness, redness, you get soreness. I mean, you're giving this shot for quite a while, and it does tend to cause some deep muscle soreness. You feel like you worked out your butt muscle. The other thing you're going to notice is breast tenderness. You could have some moodiness as well. But as far as the site itself, how to limit those side effects, I do recommend warming, using like a heating pad or a warm compress after, massaging the site. All that warm and that massage really helps the medicine absorb into the system. And then using your muscle. If you can give this shot in the morning and use your hip muscle all day while you're walking around and just going about your daily life, can really help the medication absorb. The worst thing to do is to get this shot right before you go to bed and not use your muscle and not like do any massage or deep heat. So hopefully that will help reduce those side effects for you.
Perfect. And thank you very much. And I know that's another reason why, and we mentioned it before, but all of these videos are saved and stored so you can watch them on demand. So it's great to get a chance to check them out in advance so you're prepared and you're ready for these shots before you need to actually take them, but then you can watch them 5 minutes before you give that shot so that you can remember some of the more specifics that Laurel just mentioned right there about how to mitigate some of these issues and to remind yourself not to just go and lay down on the couch after you give the shot, things like that. This is a great way to use these videos. Maybe sometimes you want to watch them multiple times. So that's great. Thank you so much. And so Laurel, again, some of these questions are coming in based on some of the answers you're giving. So it's great that you just mentioned there about that you're going to be on this shot for a long time. And so you also touched on the way the product works, but I guess this question kind of tying those two things together is just saying, how long should I expect to be on the progesterone and oil once I start, and why? Okay.
So why obviously is to maintain the pregnancy. And the length of time that you're on this medication depends on what type of a IVF cycle you're going through, or maybe you went through an intrauterine insemination and you're using progesterone. That way, that can also be prescribed. But for a frozen embryo transfer cycle, as I said, you're not making any progesterone on your own, and expect to be on this medication about 12 weeks, until about 12 weeks of pregnancy. So that is quite a while. If you're taking this after an egg retrieval and then a fresh transfer 3 to 5 days later, then it's a little less because your body is making its own progesterone, but do expect to be on the progesterone for about till about 10 weeks of pregnancy.
Perfect. Thank you very much for that. And again, part of this program is not just to teach you some of the key, the key aspects involved in the injection itself and walk you through, obviously, although that is a big part of it, is walking you through the injection itself, but to also get you prepared for some of these different types of things, like how long you'll be on the medications, so that there are no questions or concerns or surprises when you're ready to give that first shot. You've gotten all that out of the way because you've asked all the questions that you need to know now up front. So with that being said, it looks like we are caught up with our questions. So I do like to give people another 30 seconds or so, just in case they're trying to type something in, or your last answer, triggered a new question that somebody has. But so in the meantime, I'll throw it back over to you if there's any last stories that you would like to share, but just let everyone know once we move on, it's not like you can't ask questions about progesterone and oil anymore. We will definitely keep the floor open for questions about all the products tonight. So I'll throw it back over to you as we get ready.
Okay. All right, Craig. There is something that comes up a lot in my teaching as an IVF case manager, and that's the debate on whether you aspirate or you don't aspirate. And I didn't mention it in my video, and I'd like to talk a little bit about what is aspiration. When you use the dorsogluteal site, which is this one that I showed in the video, it is still in the literature, it is still suggested that you do aspirate. And what that means is to, when you're injecting, right before you inject the medication, you pull back on the plunger and you look for a little bit of blood return into that syringe. If you see blood, that means that the tip of the needle is directly in a vein, and you can't give the medication right into a vein. So you need to pull out, change needles, and go to another site. Now, this is extremely rare. Typically you're gonna pull back, you're not gonna see anything, and you're gonna give the medication. It's not an issue, but it is something that they still recommend. However, there's another site here called the ventrogluteal muscle. It's on the side of the hip. And as you can see, this is the hip bone, okay, the iliac crest. And if you make a V with your fingers touching the iliac crest, you can see the site there. This site is extremely good to use for intramuscular shots, and you don't have to aspirate. So I just wanted to mention that. So really, with the two side sites and the upper outer quadrant sites, you've got 4 sites to give your shots, and I recommend going to all 4 of those to help decrease those side effects we talked about. Just rotate to all the different sites, and that should help.
Perfect. Well, thank you very much. That's great. And we are all wrapped up with questions as of right now. So we are ready to move on to the next product. But again, everyone, if you do think of other questions, you want to throw them back to us, we have 2 more products to go through. Back to you.
Okay. So the next product is Minipure. So what we're going to do is talk about how to mix this one, how to give it. This is a nice little 1/2-inch needle. So you'll like this one. All right. So Craig, if you could start Minipure, that would be great. Hi, my name is Laurel, and today I'm going to demonstrate how to mix and give the Minipure. Minipure comes in little powders, and we're going to use our imagination, and we're going to pretend that there's little white discs of powders in these vials. You'll also need a container of saline, a Q-cap, which is a needleless mixing device, a 3 ml syringe, and a small needle for giving. So make sure you have all your supplies ready. And the first thing you're going to do is take the caps off of your supplies. Now, some clinics are going to order for you 1 vial of Minipure. Others will give you 2 or 3. So just follow your clinic's instructions on how many vials of Minipure. Each vial is 75 units of medication. So if you're told to give 150 units, that would be 2 powders. You're always going to be able to mix this Minipure and give it as 1 shot. So the next thing we're going to do is to peel that off. The Q-cap will go directly on the liquid. Just pop it on and take the plastic covering off. So it looks like this. Then you're going to take your 3 ml syringe and you're going to put 1 milliliter of air in the syringe, and you're going to twist it onto the Q-cap. Now, keeping it on a hard surface, you're going to push the air in and invert it. Draw up 1 milliliter of the liquid. So you go a little past the 1 and you push the air out until you're right on 1. Pull off your liquid and put it to the side. Now we're going to pretend to mix the powder. So here's the first powder. You push the Q-cap on, you inject the liquid into the powder, and you swirl it very gently. This powder will instantly dissolve. Now, if you have a second powder that you need to dissolve, you're going to push the air in while it's inverted, pull everything back into the syringe, take the empty vial off, put it to the side, and then do the same thing with the second powder. Push it on, inject this into the powder. It will dissolve immediately. Swirl a little, turn it upside down, push, and pull all the liquid back into your syringe. Now, when you're done with all of the powders that you've been told to inject, you're going to twist everything off while you're still pointing your syringe at the ceiling. And you're going to take your small needle and you're going to add the needle. The needle goes on like this. Twist it on, pull the cap straight off. And now it's time to get rid of that air. So just push until you see a drip of liquid at the tip. And you're ready to give your shot. So this is given in the abdomen. Pick a spot, stay an inch away from the belly button. Don't inject into a spot that has a bruise from a previous shot. Anywhere you can pinch some fatty tissue, just give it a pinch, inject straight in at a 90-degree angle, let go of the pinch, inject your medication, wait 3 seconds, grab a Kleenex, pull out, and hold with the Kleenex. After about 10 seconds, check your skin site. If it's dry, no bleeding, you're done. If it's bleeding a little medicine's leaking out, just keep holding it until it's dry. Everything goes in a Sharps container, and your next shot, you're going to get a whole new supply. That's all there is to it.
Were there any questions, Craig, that came in on Menopur?
Yes, so a couple came in. So the first question here is similar to the way we started off the last product is, what is the purpose of Menopur and why would I use it instead of FSH alone? I have friends that are doing both, so I just want to be prepared.
So Menopur is a combination medication. It's got FSH, or follicle-stimulating hormone, and LH, or luteinizing hormone. It's a combination of the two. And both of these hormones are necessary for the follicular growth and development. And they work together to help the ovaries mature in order to harvest multiple eggs at egg retrieval. Or if it's being used prior to intrauterine insemination, the purpose is to push the ovaries to produce 1 or 2 mature eggs. So using FSH alone is appropriate for some patients because they're making some LH on their own. So it's not necessarily, Menopur isn't necessarily something that you have to give. However, I would ask your clinic what's right for you. Most doctors are ordering a combination of an FSH-only medication like a Gonal-F or Follistim and a combination medication like Menopur. And this is given to most patients by most doctors because the body needs more FSH than LH. And so they're getting both, and that stimulates the ovaries to produce the eggs. So the bottom line is just to ask your provider what's right for you.
Great, and that is a great thing to throw in there for just about a lot of these questions, right? Is we're going to provide as much information as we possibly can. That's the purpose of the PharmAssist program, but also at the end of the day, specifics about your treatment, your dosage, why this product instead of that product. A lot of that we're just going to direct you back to your clinic because there's a reason why there are a number of different options on the table. And that's the great thing about going through fertility is that there are a lot of options, but it also means that the specifics on why one versus the other is ultimately going to come down to a conversation between you and your clinic and your HCP. So thank you very much for that question. And then this one is a little bit more specific to the product itself. And it is, what do I do if I miss a shot of Menopur? Am I in trouble?
Well, if you miss a shot of Menopur, if you forget to take it, you're going to want to take it as soon as you remember, and then make sure you call the clinic and let them know what time you took it for further instructions. They may have you take
your next shot at the same time, or they may adjust it a little bit. The most important thing is to call them and have that open communication with you in your clinic so they can tell you how to adjust things. But it doesn't mean that your cycle is ruined. It just means that, it was a little late. Just take it when you remember and call your clinic.
Thank you very much. You probably put a lot of people's mind at ease right there. So that's a good one to know, that you have some options. And I think it gets back to your original point that any question that people may have or issue that a patient may face, you are definitely not alone. You are certainly on an island of many, and many other people have gone through that situation before. And that also means that your nurse has heard that question before or seen that situation before. So the best answer is always to reach out when you have these types of questions, especially because you don't want to feel like all is lost if there are a lot of options on the table. So thank you for asking that question. And that probably applies to all of the products that we're talking about, as something that you should keep in mind. So speaking of, in terms of how people are utilizing and issues that they may have that other people have gone through, with the holidays just having passed, the question comes in: how do I store Menopur if I start traveling again?
If you're lucky enough to start traveling again, Menopur can be stored at room temperature or refrigerated. Anywhere between 36 and 77 degrees is fine. So this time of year, you don't need to worry about any special precautions with traveling. Just make sure that if you're taking a plane, that it is clearly marked with your prescription label on the outside. You don't want to take it out of the box that it came in without your prescription. Especially with the needles, they want you to have your prescription. Then in the summer months, it can get really hot. It can get above 77, obviously. So I would recommend putting Menopur in a container that's insulated with an ice pack in there to keep it cool. That's it.
I just like that you mentioned summer, because it reminds us that summer will come eventually, and we'll be out of the winter, at least here in New Jersey, where it has dropped into freezing pretty often. So sounds good. Stay positive. We're almost there. Thank you very much for that answer. That was great. And then another one specific to the Q cap that you mentioned. So you walked through how that is used and the purpose of it. And the question just came in that it says, do I have to use the Q cap to mix my Menopur? It seems like it's just an extra step.
Well, the Q cap, let me just show you the Q cap. Again, this is a needleless system for mixing. It has this little thing here, but you can't hurt yourself with it. It is the greatest invention, I think, ever. The bottom line is you don't have to use this for the mixing, but it makes it a lot easier and a lot safer. So I'd highly recommend it. If you choose to use a needle instead to do the mixing, talk to your clinic and they can work out getting you those supplies if you prefer that.
It sounds like you're definitely a fan of it, so that's good to let people know, because there's a reason why they have that in there. And anytime you can make it easier on yourself, especially with multiple medications and going through that, it seems like you should probably take advantage. So you have an opportunity there, but good thing to follow up on. And again, talk to your clinic if you would like to do otherwise. So with that being said, it seems like we are caught up on questions right now. So let's do the same as we did before. Give another 30 seconds or so for somebody who is furiously trying to type in that last question before we move on. And then we'll see if anything comes through. And if not, we can get ready to move on to the next and final product.
Okay. Well, let's see. There's a question that comes in a lot with Menopur, and that's, what are the side effects? The side effects can be some bruising at the site, a little bit of discomfort when you give this shot. The stinging can be pretty bad, worse than other injections. My recommendation on minimizing the sting with this shot is to give it as slowly as you can. So just, slow it down. If it's starting to hurt while you're giving it, you can just slow down the pressure on the plunger. Other side effects that you might experience would be moodiness, fatigue, and of course, the bloating in your pelvic area. The Menopur is stimulating the ovaries to produce multiple follicles. Those follicles are growing. Your ovaries are getting bigger. And then the ovaries are protected and they're in the pelvic cavity and they're on a stalk. And so when the ovaries get heavy, they pull on that stalk and they cause like a feeling of heaviness and pulling. And it feels like you're carrying a couple rocks around in your stomach. So that's normal. Those are all normal side effects. If you have any like severe nausea, vomiting, shortness of breath, anything like that, then those are symptoms of hyperstimulation syndrome and you want to call your clinic for that. But that is more rare. Okay, so I just wanted to mention that until any other questions come in, and if not, we can move on to the Sanera patch.
I think we are ready to move on. And then again, if you think of any other questions about Menopur or progesterone oil, feel free to share them, but we are ready to move on to the third and final product.
Okay, great. Sanera patch.
Hi, my name is Laurel, and today I'm going to show you how to use the Sanera patch. The Sanera patch is used to numb the site before you give an injection. It can also be used for an IV start. It can be used for a lab draw. So whatever you need for it, it numbs the skin. So what you're going to do is you're going to open up your package and pull out your patch. It's a combination of lidocaine and tetracaine. It is activated by heat, and it gets the medication into your skin using the heat. So what you're going to do is pull this back. The medication is in the middle, so you don't want to touch that part. You want to make sure that the place where you're putting the patch for your injection is clean and dry. And then you're going to place that right on the area where you want to give your shot. Make sure that you don't cover these holes because they do need to stay open to air to activate. And you're going to leave that patch on for 20 to 30 minutes prior to giving your shot. Once 20 to 30 minutes is done, you pull it off. You place your one-time use patch right on the cover, and you'll notice that it feels warm because once it's pulled off, that warmth activates it. And then you're ready to give your shot in that exact spot where you had your patch. And you probably won't even feel it. That's all there is to it.
Okay, Sanera patch numbs the skin, can't feel your shot. What could be better, right? So any questions about the Sanera patch?
I love how easy it is to talk about that one. And it's one of the best ones because it's really helping with all this stuff that a lot of the questions people had earlier about side effects. This is the product that'll help you out with that. So great. So let's see. The first question coming in is, okay. So how can I find out how much the Sanera patch costs before I decide whether to use it or not?
Yeah, so Sanera patch obviously is up to you, and if you want to order it or not, you could ask your clinic to order it. You can easily find out how much it's going to cost you by just talking to the Mandel's pharmacy people. They'll look at your insurance coverage, tell you the cost of the patch with your insurance, or if you don't have insurance, how much it is out of pocket. And then you can also order just 10 patches just to give it a try. And that minimizes that initial cost. And you can see if you like it or not. And if you do, you can order more then.
And that is actually a perfect time to bring up that, yes, as you mentioned, Laurel, thank you very much. That, yeah, Mandel's part of what we do is financial service checking. So we'll go through and check out your coverage. We will determine if you have coverage or not, if you pay out of pocket, what it would cost. And we definitely find out how to get you the lowest possible price. So a lot of that, so you won't be surprised. So we make sure that all of these things are worked out in advance. And we're always looking to find the cheapest way to get you the product so that you aren't paying, unnecessarily. So that's a great way to check it out. And to Laurel's last point, you can always decide if you just want to try out a little, just a few, just to see how it works and determine, okay, yeah, this is great. It's worth every penny. And I want to make sure that I continue to use it. And that's the best way to really know cost to value with the product. So thank you so much for that, Laurel, and for helping us out as well, letting people know that that's part of what Mandel's is here for. So next question says, I am worried about potentially overdosing with the Sonera patch. Is there a risk if I use it longer than the prescribed 30 minutes?
Okay, so it's best to take the patch off after 30 minutes. Your skin will be plenty numb enough after the 30 minutes. However, a study was done where they put 4 patches on simultaneously, left them all on for an hour, and then they measured the blood concentration of the lidocaine, and they found that it was extremely low. So the risk was just very, very minimal. So I wouldn't worry about if you leave it on a little bit too long. You're not going to run into any serious side effects. There are some side effects of the patch basically right on the skin surface that you might notice. It gets pale, your skin can get pale, or it can get pink, red, or a little bit numb, but you can pull that patch right off and it will go away right away.
Perfect. Thank you for that. Let's see. So another question that says, okay, what does it mean when you say to not cover the injection site? Does it mean that I can't wear clothes over the patch or something else? I just want to make sure that it works for me when I use it.
That's a good question. That was kind of confusing. You can definitely wear clothes over the patch. An iron powder triggers the warming effect of the patch, which helps the medication absorb. But and so the patch needs oxygen to stimulate that warming effect. But clothes do not hamper this at all. Clothes is not what I meant. I guess I was just thinking about, like, you wouldn't want to cover it with cellophane or tight clothes, real tight clothes.
Perfect. Yeah, I think sometimes there's been circumstances, we've even heard at the Mandel side, that sometimes people will think because of pain, like they'll put on a patch and then think they want to put on like one of those like wrap it in like an athletic tape or something to try to help with the pain. Don't do that. You do not want to do that. You want to let it breathe. But yes, a shirt or something like that is not going to be a problem. So good. You don't have to lay down with nothing for a little while with these patches. You can be comfortable knowing that you are going to be using it correctly. And with that said, this one is kind of it's kind of an easy one. There's not a ton of questions typically when we do the Sonera patch, because people just kind of know how it works. And you have your 1 or 2 questions about, like we just said, in terms of cost or something like that. But it seems like we're all caught up with questions there. So again, now I will say we can open it up to everybody for questions about all 3 of the products that we talked about, or if you have any questions for Laurel that you'd like to get into just about your treatment cycle in general. But we'll give it another 30 seconds or so, a minute, while people get a chance to get that question in there. And I'll turn it over to you as we get prepared to start wrapping it up tonight. Okay.
Well, thank you everyone for being here. I really encourage you to type in your questions if you have any. Any question you have is going to help other people. So it's not too late. You can go ahead and ask anything you want about these medications. All of these virtual learning experiences through PharmAssist, including tonight's, are available. They are available anytime. You just go to mymandelspharmacy.com. You could also go to Mandel's Facebook page or to YouTube. So they're always available. So any other questions come up, Craig?
I'm checking all the different places. Let's see. It looks like we are good to go. So I think we have gotten most of the questions. So I do want to say, once again, thank you, Laurel, so much for your time and your expertise tonight. We really, really appreciate it. All of the amazing, not just the stories you were able to share, but also just the answers to the questions that really helps put people at ease. I want to thank everybody back home who has joined us via Zoom and Facebook Live and for sharing all of the excellent questions that they had. We hope that you at home were able to learn something tonight if you asked a question, and if you didn't ask a question, if you learned from all the great anecdotes that you were able to hear tonight. And as Laurel mentioned, you don't forget that all the virtual learning experience videos, or VLEs as we call them, as well as those individual bite-sized little clips, the product demonstration videos are available on demand at the YouTube, Facebook page, and I said the YouTube, wow, on the YouTube page, our Facebook page, and at mymandalespharmacy.com/PharmAssist. And so I want to say, just from our end, we look forward to seeing everybody here again next Monday night at 7 p.m. Eastern Standard for another great program. And before I turn it back over to you to just say, if you have anything else that you want to share, Laurel, before we say goodnight to everybody.
I'm good. Well, I just want to say, everyone, just keep the faith, take it one day at a time. You're going to get there.
Awesome. Thank you so much. That's the purpose of the program, is to make you feel comfortable and know that you have the support of many people, maybe behind computer screens, but we're all here for you. And we want to be able to make sure that you get those questions answered. So if you feel like you learned anything tonight, or you feel like it was something valuable, the greatest way to help this program grow is to share this program. If you know of a family member, of a colleague, of a friend, just somebody that you bumped into at Target yesterday that you think might want to know about it, share this program and let them know, because that's the way the program is going to grow, but also the way we can share the information that we're all here for tonight, which is to get better and feel like pros by the time we're ready for that first shot. So thank you, Laurel. Thank you so much. Thank you, everybody back home. Thank you, everybody at Mandel's, for helping to put this program together, and have a great night. We will see you next Monday night.